Hi, I'm Dr. Ankita Harijee, consultant plastic, reconstructive, and aesthetic surgeon at Ilumna by Star Hospital. Today we have with us Dr. Kinnera, who is also a plastic surgeon. Together, we are diving into a topic which is incredibly close to most of the mother's heart, that is, Mommy Makeover. It's a customized combination of procedure. It's designed to make sure that mother restore their pre-pregnancy body and this boosts their confidence. So our aim is to make mothers feel vibrant, confident, and comfortable in their own skin. Hi, Kinnera. Today I had an interesting consultation where I had a new mother who walked into our OPD and she was looking for mommy makeover. Are you also seeing a lot of these cases too?
Yes, Ankita, definitely. Because in fact, I'm actually very happy that more and more mothers are trying to reclaim their pre-pregnancy bodies. So that's a very happy thing. And in fact, we're getting a lot of queries on social media as well as the walk-in clients who come for other procedures hear about these mommy makers in the advertisements and all that. And they in fact ask us very curiously about what exactly are these procedures and the pros and cons of getting it done. So, your patient, which procedure was she particularly looking for in the mommy makeover?
Yes. So after consulting her, we decided that she wanted a combination of tummy tuck, breast lift, and liposuction.
Okay.
So it's incredible that how when we put all these procedures together, it makes a dramatic transformation in them.
Yes, yes. Tummy tuck, in fact, is a very important part of mommy makeover because it addresses the most important aspect of the problem, that is the sagging skin post pregnancy, be it multiple or a single pregnancy. A lot of mothers face a lot of difficulty because of the sagging of the lower abdomen. So, can you please elaborate more on the tummy tuck?
Yeah, sure. So in tummy tuck, what happens is those who have a lot of pregnancy, they have weakness of muscle. But if someone had cesarean delivery, they might not have the weakness of the muscle. So in tummy tuck, we address this procedure, like we tighten the muscle. So this helps to make the abdomen flat. Along with that, the core strength is also increased. Then we add one more procedure to this is there are loose hanging skin post pregnancy, which after pregnancy does not come back to its normal shape. So that is a discomfort for them. Along with that, they also have a lot of fat deposit over there. So we can remove that excess hanging skin in the lower part of the tummy along with the fat. Plus, what do we do is we change the position of the belly button. So it doesn't remain at the same position, it is changed to a newer position.
Yes. And do you also recommend the tummy tuck procedure for a mother who had a single pregnancy? And do you think that the mother can, in fact, go for the second pregnancy after undergoing a tummy tuck procedure?
To say truly, I would really advise them to finish their family, complete the pregnancy. If they are planning another pregnancy, to finish that and then come back to us. Ideally, they should be finishing 6 months after breastfeeding when they come to us for consultation. Because what happens is post pregnancy, because of the hormonal changes, they will have a lot of changes in the body. And there is a possibility that the stretched lower tummy skin might shrink back.
Okay.
So if we do the same the procedure in the same setting immediately after the pregnancy, it would be an overkill of a result.
Yes.
So it's ideal that we consider a 1 year waiting period post delivery so that they can have a good result.
And do you think that this tummy tuck procedure is also beneficial for the patients who have a lot of stretch marks in their lower abdomen?
Yes, I wouldn't say that it would address the stretch marks above the belly button area. But yes, those who have the stretch marks in the lower half, below the belly button area, that can be addressed because we are removing that loose hanging skin along with the fat. So automatically the skin along with the stretch marks would be removed. So we can address at least the part of stretch marks which is lying below the belly button by removal with the skin.
Okay, that's good.
Okay, and one more thing I wanted to add was that we should make sure that these procedures are not done along with the cesarean section, because I had many patients asking me that can it be done when I'm getting my cesarean section done.
Yes, yes.
So we should make sure that we educate them that they have to wait, because with a proper diet and exercise also many people come back to their pre-pregnancy body.
Correct.
But if they can't, even after 1 year post-delivery, then definitely they should consider this procedure.
Yes, that's a very important information.
And Dr. Kinnera, can you just highlight about what all procedures we do in breast?
Yes, breast surgeries are one of my favorite procedures too, a part of the Mommy Makeover. So in Mommy Makeover, we have a combination of breast surgeries like the breast reduction, breast lift, augmentation, mastopexy, etc. So breast reduction per se, usually the mothers present with a large, dense breast, probably because of multiple pregnancies, lactation episodes and all that. So they are really, they look for reduction in the size of the breast because they suffer a lot because of the heavy weight. They present with shoulder pain, neck pain, a lot of infections beneath the large breast and all that. So they come to us to just ask us to reduce the size of the breast. That's when we excise the excess breast tissue and give them a more contoured, smaller breast, but which is more proportional to the body of the mother. Whereas in breast lift, the mothers are generally happy with their volume and size in spite of being post-lactation and all that. They're still comfortable with the breast volume, but they have a complaint the breast appears very saggy. So in breast lift, we address only the sagging part of it and give them a more firmer breast. Whereas coming to the breast augmentation, these clients have completely deflated breasts. And they also have sagging and loss of volume and all that. So and they look for enhancement of the breast size. So in those clients, we offer them a combination of the breast implants along with the breast lift surgery to give them a more enhanced size breast. But the ultimate goal in these breast surgeries will be to give them a more contoured breast, which is more proportional to the size of the mother, thereby giving them a more youthful appearance. So what do you think are the other surgeries apart from the breast and tummy tuck?
Before we get into that, I had a couple of doubts related to the breast surgery.
Yes.
So do you feel that what is the right time they should get these breast surgery done?
Yeah, so ideally, like you already said about the tummy tuck, it's preferable that the mothers wait for at least a period of 6 months to 1 year after they finished a pregnancy. In fact, it will be advisable to finish the entire family and then go ahead with the breast surgery. But then if they are suffering too much with the breast size or anything, we can advise the breast reduction surgery or the breast lift surgery after about maybe 6 months post delivery.
And can you tell us something about breastfeeding post breast reduction surgery? Like, does it affect their breastfeeding anytime?
Yes. So
if they decide to get it done just immediately after a pregnancy and before their next pregnancy?
Yes. So we forget about Mommy Makeover. We do have clients who present to us in pre-pregnancy state also, who suffer with heavy breast because of congenital hypertrophy of the breast or other reasons. So in them also, even before they go in for the pregnancy, we can do a breast reduction surgery wherein we preserve the breast gland as well as the nipple sensation also. So our goal is to only remove the excess fat there and so that the patient can actually feed the baby when they become pregnant. So in majority of the clients, even after we do the breast reduction surgery, breast lift, in fact, even after putting an implant, some of the clients can even feed the baby. They can, they have successfully breastfed the baby. So that said, we can go in for the breast surgeries even if the patient is planning for another pregnancy also later.
Great. So you were talking about the alternative procedure. So I would like to add on that during pregnancy, they gain a lot of weight too.
Yes.
So they might have fat deposit in the abnormal location, like love handle area, the saddleback area.
Yes.
So we can even add liposuction to this because this helps to contour and remove that stubborn fat. Plus, there are some mothers who have some changes in their face which are not comfortable to them post pregnancy. So they can consider Botox, filler, or thread lift. It depends entirely based on what all changes have happened in their face. So each procedure is tailored to their unique needs.
Exactly.
Can you add on to any additional procedure if I'm missing something?
Yeah, so very rarely certain mothers come and ask for buttock enhancement also. So we can do fat grafting for the buttocks. We also have buttock implants, even though it's not quite familiar, but then we do have that option also, because every mother deserves to look at their best, like in their pre-pregnancy state. And we do have genital rejuvenation procedures, both surgical and non-surgical. So in surgical, we have something like labioplasty, vaginoplasty, which give the more rejuvenated vagina. We do, if they do not want surgical, we also have non-surgical options like PRPs, threads for the vagina, G-spot enhancement, and etc. But of course, these are all personalized to the mothers who wish to have these, even though it's not mandatory for every mommy makeover.
Yes, and not to forget, if we have to maintain these results, we need to have a healthy diet and exercise.
Yes.
Because these are not something which is a weight loss procedure. We are
Yes.
trying to reshape them to their pre-pregnancy body.
Yes.
So when they say that, am I going to go and lose weight? Yes, there will be a loss of weight, but this is not going to be maintained with these procedures.
Yes.
They have to have a healthy diet and a good exercise scheduled in their lifestyle so that they can maintain these results. Can you just tell us about the post-op care they should have?
Yeah, so recovery is a very important aspect of it. Of course, while maintaining the expectations of the patients, we should also focus on the recovery. And many mothers are actually surprised about how they handle the recovery also with proper planning and support. So unless they follow certain post-op healthy lifestyle and the recommendations that we do, they will definitely have a long-lasting and permanent results.
Great. So yeah, the aim is not to just have an aesthetic improvement. We are aiming to improve their quality of life and self-esteem.
Yes.
So
do you have any important memories that that showed a big difference in the mommy makeover?
Yes, I did have one mother, which I recollect, who was very hesitant in the beginning to consult us. Basically, she told us that she was like very outgoing before her pregnancy. And after pregnancy, she started restricting herself, her social activity, because she became conscious about her body. And she consulted us after like maybe a long time after her delivery, and we explained to her the pros and cons of the procedure, and we decided the procedure based on her requirement. And after mommy makeover, she had a dramatic transformation.
Yes.
And this has boosted her confidence to a great level.
Yes.
It's a privilege to be a part of their journey, because how it's making a change in them and how happy they are and comfortable in their own skin makes a lot of difference.
Yes, definitely. That's wonderful, because things like these actually remind us about what we do and why we do things. So to sum it up, Mommy Makeover is a wonderful transformative journey that includes a combination of surgeries, be it breast surgery, tummy tuck, liposuction, or other surgical and non-surgical rejuvenation. Our overall aim is to restore a mother's pre-pregnancy state, and it's not just about the physical changes that happen to her. It's also about to significantly boost her self-esteem and give her a better mental and emotional well-being. So here's to looking out for many more happy transformations to all the mommies out there. Thank you.